All right. Well, thanks everyone for having us here today. So Gabby and I wanted to present to you some basically the results from an ongoing series of projects that we've been working together on. So this specific presentation will focus on the structural racism that's affecting Latino communities and Latino population health during the pandemic and beyond. So the specific research objective of this particular piece of work was to identify the different forms of racism that Latino communities in North Carolina were experiencing during the COVID-19 pandemic. And just wanted to highlight the team, a really wonderful team that was being led by both me and Gabby, but we also have Rohan Gupta, who's an undergraduate at Duke, as well as Kamaria Kayland, Viviana Rosa Gonzalez Guarda, and also Rushina Chulera. So back in July, we spoke with many of you. So thank you again for those of you that joined us last year. We conducted 3 focus groups with 16 of Latin 19 community members. And we asked the participants to discuss different or the questions themselves focused on community and policy interventions that improved COVID-19 related care, but also what were the continued policy gaps and what the lessons learned were from the experiences to date. The focus groups were conducted by me and Gabby in Spanish, and these focus groups were recorded and also transcribed. And we analyzed the data in Spanish and did a type of a methodology to be able to identify the key findings and recommendations. So I'm going to hand it over to Gabby to review that.
Hola a todos. Thank you so much for being here. So as Andrea was saying, our key findings for this study, these are some of the findings. We're still in the process of analysis, and so we'll have some more findings soon, and you all will be helping us with part of the analysis shortly. But for this part of the analysis, just looking at what was said during those focus groups and what the key themes from those focus groups were, 3 systemic barriers that were brought up multiple times were the lack of timely communication in Spanish from trustworthy sources, lack of consideration of how proposed solutions would negatively affect the Latinx community. So an example of that was the rapid tests. They were available. They were, everybody was told to go get them, to use them in preparation to go back to work and school and that sort of stuff. But the instructions for them were often not available in Spanish. There were limitations to how many each person could get. And on top of that, there wasn't very good education about when they're appropriate, when they're not appropriate, available at the very beginning. Of course, Latin 19 has done a lot since then to educate the community about when these tests are appropriate versus when to get a PCR test, both to the community and to our community health workers. But that's just an example of how something that was meant to be positive was not appropriately assessed from the community perspective and how it would affect the Latino community. And factors contributing to perceived relationship between community-based events and government and institutional interest in Latinx health. So this is where we heard a lot in our focus groups that people were saying, bueno, ahora se acabó la pandemia, pandemic is over. And so we're not seeing any tents, we're not seeing any, Duke people out in the community anymore. Does Duke or does the Department of Health, they don't care about us anymore, right? The pandemic is over, where are the resources? We still need help. And so how do these community-based events impact the perceived interest of the institutions and the government in Latino health? So those are some of our key findings. Next slide, please.
Habla más lento, Gaby, para
Sí, claro,
Felipe.
perdón, que soy dominicana y siempre hablo muy rápido. So key policy recommendations. So number 1 is making it institutional and government policy that as soon as materials are available in English, that they are also co-created by community members in Spanish. because often what we've seen with COVID and then with monkeypox, information is available in English, and then it takes a long time and a lot of effort from Latinx and all of our community partners to get it available in Spanish. Integrating community-based organization leaders and community health workers and other healthcare and social service providers that are more directly connected to the community in discussion of policy and how those policies impact the Latino population can help prevent unintended consequences. And prioritizing values of the Latino community, such as community-based events. The Latino community very much prioritizes in-person, one-on-one interactions rather than Zoom, phone, etc., because that's how you get trust. And so prioritizing what is valued by the community in order to sustain or regain that trust. And finally, having better mechanisms of funding community-based organizations so that funding is distributed equitably based on strengths of those community-based organizations, and also to foster collaboration can help improve and sustain the work that the community has been doing. So what's next? The next part of this project is not only to do the thematic analysis of what was said, but also to do a systems mapping analysis, which is what I'm going to show you next. And that is a way of seeing how things are interrelated. We will be presenting a poster related to this research at Academy Health annual research meeting in Seattle in June. And then we're writing the manuscript and submitting it to an academic journal. And so we will be reaching out to our community partners to review everything that we're working on every step of the way, just to make sure that we are appropriately representing what we've learned from all of you. So what is systems mapping? Systems mapping is a way of understanding what topics, elements, people, whatever the resource might be, what are they and how are they related to each other? And when we look at how they're related to each other, we want to know what direction the arrow goes in. So from here to here, or from here to here, or is it going in both ways, or is there no direction? So what is the direction? And then what is the value of that direction? So is it positive or negative? And when I say positive or negative, that doesn't mean good or bad. It just means that A impacts this in a way that makes this increase, or impacts it in a way that makes it decrease. And you'll see that sometimes, for example, certain things increase fear, right? And so it'll have a positive, but it's not because that's a positive thing. It's because it just increases fear. Does that make sense? So we'll see an example of it now when I show you a map. Next slide. So this is an example of a different study, not ours, where they were looking at how COVID-19 affected community well-being. And this was done by a bunch of researchers, and there was no community involvement in this study, and it was not focused on Latino community. And so our work is different in that we will be focusing on the Latino community and involving the community in both the focus groups and in the analysis portion of our work. And you can see here how there are arrows in different directions, and there's little negative, positive signs. And then the circles with an R and a number, that's just a technical term that means a reinforcement loop. And each loop is numbered, but then in the manuscript or when you're discussing, you can talk about loop 1, loop 2, loop 3. But if you look at R2, which is over on your left-hand side, it's in between trust in local, thank you, Andrea. It's in between trust in local public health and belief in fake news. And so this is a very small loop that I think highlights how these loops work. So trust in local public health decreases belief in fake news, but the belief in fake news decreases trust in local public health. And so this is a negative feedback loop, right? And so if you are trying to come up with interventions, for example, of how to improve trust in local public health or how to decrease belief in fake news, this would be a loop of interest that you would try to find an intervention that would break up that loop in some way. And so that's an example of how this can be used. Yes, I can provide a link for the resource, Dr. Mitchner. And so on the next slide, this is an example of how you can zoom out from the overall system to see connections related to specific elements. And so here they were focused on community well-being, and you can see how certain themes and topics were related to community well-being with those red arrows. And you can see at the bottom, I think it got cut off a little bit, but you can see at the bottom that part A was about how imposed mandates affected physical well-being. Part B was about how those, state mandates versus, other things and how that affected parts of well-being, so physical, mental well-being, et cetera. So today's goal is to review the systems map that we've created based on the themes and topics that we discussed during our focus group sessions back in July, and to get feedback from all of you as our community members on different relationships, directions, and their values, positive or negative, that we may have either misinterpreted based on what we've heard in the focus groups, or that maybe we just didn't see that you all might see better, and so forth. Okay.